Hey there, my name is Callie Counterman. I'm the owner of Mooch Lactation here in Austin, Texas, and I'm also an international board certified lactation consultant. Today I'd like to offer some exercises for you to perform with your baby prior to and post of their frenectomy. Let's dive right in. The following exercises can be done 3 times each, 3 times a day for at least 3 weeks. If you don't hit it one day, that's totally fine. Remember that you're in the early postpartum period. Let's just do the best that we can. The first exercise we're going to walk through is called the meltdown. What we want to do is take our hands up to the top of baby's cranium. We're going to gently compress on their heads. We're going to gently drag our fingers down the sides of their cheek muscles, through their temples, down through their cheeks, all the way through their neck muscles, and finally down to the shoulders, where we're going to push down and out and hold for as long as baby will allow us. Sometimes baby can be super rigid and stiff in their neck region, so they'll only let us hold for a few seconds, and that's okay. Again, we're going to do this 3 times in a row. Hands together at the top. If you can envision gently melting away, melting down all of that tension and pressure. I feel like I need one of these, and I'm 9 years postpartum. The next exercise we're going to do are lip flares. We can either take gloves or our clean fingers. We're going to place our thumbs on baby's upper lip, and we're going to gently pull up and flare that lip all the way up to their nares or to their nostrils. Hold for 1, 2, 3. Let the lip go. Baby might not love this one, especially if they've been diagnosed with a labial lip tie or an upper lip tie. Sometimes the frenulum tissue can be pulled really taut like a piece of tissue or a string, or sometimes it can be really elastic like a piece of elastic. It just kind of depends on baby. So let's not force it, but again, gently pull up on the upper lip all the way up. We're going to flare that upper lip all the way to the nostrils, and then we're going to let it pop back into position. The next one's a little bit hard to perform here on baby Carl, but we're going to do the best we can. Again, with a clean glove or clean fingers, we're going to place our fingers in the inside of baby's mouth. Our index finger goes along the cheek muscles. Our thumb comes on the outside for support, and we're just going to try to tap our fingers together and gently pull forward all the way till our fingers slip out of baby's mouth, and then we're going to do it again. Tickle, tickle, tickle. Wait for them to open wide. Fingers go to cheeks. Fingers meet each other, gently compress together, pull towards the cheek. This is gently just stretching out all of those super rigid, potentially super rigid cheek muscles for baby. Then we're gonna do that 3 times on each side. So tickle, 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 wait for them to open up, index finger in. We're gonna gently tap our fingers together, and we're gonna pull forward, stretching out all of that tension that we tend to hold in our cheek muscles. Next is gonna be suck training. We enter the mouth the same way, so with the tickle, tickle, tickle to our upper lip, when baby opens wide, we're going to gently put our finger in baby's mouth. We're going to compress down on the tongue. That's going to elicit baby to begin to suckle on our finger. The idea here is that we draw our finger out of baby's mouth while baby tries to suck our finger back in. It's called suck training. We can let our finger come all the way out of the mouth, and then we'll do that again 3 times. Finger in, gently depress down on the tongue. Pull finger out of mouth. And then we can do it with our fat pad of our finger up. So tickle, tickle, open up, fat pad to the roof of the mouth, where you'll feel baby's roof and their oral cavity. And then they'll also be elicited to suck. And we're going to do the same thing, draw our finger back out of the oral cavity when they try to suck it in. The next one we're going to do is called a guppy pose, or I like to call it a neck release. We're going to gently walk our hands back behind baby's shoulder blades, kind of right where our fingertips are on the nape of their neck, and we're going to gently push up, which is going to allow baby to come up off the ground a little bit, and we're going to see a big neck tilt here. Baby's chins should be pointed to the ceiling. We're going to hold this pose for as long as baby allows us, at least 10-15 seconds. We're going to let baby come back down and tickle, 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 and we're going to do that again 3 times. Fingers on the shoulder blades, right where the nape of neck is. We're going to gently lift up, and we should see our baby's head gently tilt back. Chin should be pointed up to the sky. And finally, our last exercise today, which will make 6 total exercises, will be our hip tilts. This one's particularly good if baby's struggling with body tension, which means they're preferring to look to just one side, they're preferring just to nurse on one side. It can also help sort of let any kind of tension go and kind of realign their GI tract. A little bit of body work is what we like to call it, okay? So this last one's going to be called hip tilt. So it's exactly what it sounds like. We're going to take baby's little squirmy wormy feet. We're going to bend them over to the side, and we're going to try to envision baby's hip bone coming up to touching their little rib cage. So we're going to tilt the hips, and we're going to hold, and we're going to let them come back to normal resting position. Then we're going to tilt the hips and hold. And so we do that 3 times on each side. And that's just kind of, again, releasing some of that body tension left over from delivery. Okay, guys, good luck with your at-home exercises. Again, these exercises don't replace anything your practitioner has given to you for homework. It's in addition to. If you practice these at home for several weeks and we're not seeing much of a difference, reach out. Let's try to get you scheduled either with an occupational therapist, a PT, a cranial sacral therapist, and see how we can get you feeling better. Thanks so much.